Carlin has been the prevention and coordinator with Alliance for Prevention and Wellness for 22 years. As a master certified health educator specialist, she has implemented education programs for the lower Naugatuck Valley and the greater New Haven in areas of substance use awareness, mental wellness, and suicide prevention. She currently oversees a federally funded initiative known as CARA, or Comprehensive Addiction and Recovery Act. Thank you for being here, Lori.
And good morning again. I'm actually here today to represent the Valley Opioid Task Force. And if you had not heard about that particular group, you're going to know all about it today. We started last August with our first meeting. We have a number of stakeholders from 3 different communities who participate on our task force. Michael Wynn, my colleague, is on the task force with us. Aaron is also a part of our task force. And the reason why we have this really great initiative is because we have 3 communities, Ansonia, Derby, and Shelton, that according to their overdose use rates per 100,000 people, we had some of the highest in our 3 communities per capita than even an urban area like New Haven or Waterbury or some of the other towns. So we have funding for the next 5 years to try to make an impact in those communities with regard to educating people about this issue, about substance use, opioid use disorder, educating young people. We also are talking about safe storage of medication, safe disposal of medication, and then really pushing for educating younger students about addiction, but also misuse of medications, because this is where it all starts. The misuse of prescription medication starts at younger ages now, with sharing of medication, or young people receiving prescriptions because of sports injuries and then not using the full prescription, and it's held on to for a number of weeks or months or years. One of the most recent activities that we just did in Derby a couple of weeks ago was to—
It's very slow.
Thank you. We did a medication take back at Derby High School. It's a national day sponsored by the DEA, and we set up at Derby High School on a Saturday morning. And ironically, the folks who came to drop off their medication, everyone was over the age of 60, and they came with, when I say bags, garbage bags full. And some of the conversation was, well, I've had this for 10 years. I didn't know what to do with it. There were narcotics, there were cancer drugs, diabetic medications not used, over-the-counter medication, which we often don't think of as being something that people would use to abuse, but over-the-counter medication also people take recreationally to help themselves if they're going into withdrawal. So there were lots of medications coming in, and all properly disposed of by our local law enforcement. So we're hoping to have another one of those events. I think Seymour is going to be the next time that we do this. And again, targeting older people, because diversion happens at home. So where does this medication come from? How does it get to the hands of young people? Stealing from our grandmother's medicine cabinets or our moms and dads if they're on pain medication management. These medications are making their way into our high school students' hands, or even younger these days. So I'm going to start with what this project is, because we were just funded last August. And so I worked for the Alliance for Prevention and Wellness. We applied for this based on the data from our communities. So this funding is, and it's known as the Comprehensive Addiction Recovery Act. It's to prevent and reduce the use of opioids or methamphetamine and the misuse of prescription drugs among youth aged 12 to 18 in our communities throughout the United States. This funding will be provided to us for at least 5 years. So we just actually completed our first year. And just to give you an idea of what it looks like in our communities, and we were even shocked by this when we actually looked back to see what some of the original prevalence data was. So Ansonia, Derby, and Shelton have sustained high levels of opioid misuse, addiction, and overdose over the last 8 years. More recently, have been the site of a sharp rise in number of non-fatal overdoses, typically due being added to either the heroin supply or pressed pills. So in 2018, which is when we actually applied for this particular grant, you can see that Derby's rate, even compared to the overall state, and the rate is per 100,000 people. The rate in Derby was at 86.6. Ansonia was high at 15.8, Shelton is high, and you see that those rates are actually higher than the state overall, or even the US. So because of looking at this and where we're at, we had to do something about this. There seemed to be a lack of awareness among our communities. This was an actual issue in our communities, and a lack of education of our young people about, you try something once right now. It's not like it used to be when I was in high school. You can share a pill or take a pill from somebody and you can die the first time. That's the difference today as opposed to when I was in high school. We didn't have access to pills. Alcohol, marijuana, yes. But certainly not pressed pills that are manufactured illicitly, and fentanyl now is added to all pressed pills that are on the streets today. In 2020 also, as we progressed into COVID, our issue with opioid overdose, both fatal and non-fatal, actually got worse, not better. So we have additional data to show that we weren't making any progress. We also have a really good relationship with high intensity drug trafficking. Robert Lawler is somebody who attends our meetings, and he is retired law enforcement, but works for our region and actually tracking and looking at where the drug is coming into, what type of drug are we looking at, and really involved in alerts. What do we need to be concerned about? What should we be looking for? And so a quote from him, because we had this Hartford issue with a 13-year-old young man who died of an overdose, which was probably, it was the first in the country where a 13-year-old had died of an overdose. We had not seen it anywhere before. So we depend on him to give us information that's going to help us with our education and where we need to target our efforts. So back in September, he was quoted as saying, right now in the streets of Connecticut, when you buy or are you acquiring a prescription pill, it's more likely that it's counterfeit and it's going to be more likely deadly. And he is our drug intelligence officer. Usually those who are buying or using drugs are unaware how much or if it is even laced with fentanyl. So you're playing Russian roulette if you are somebody who is maintaining a dependence to any particular substance. And our primary goal is to try to get the deaths under control and keep people from dying. And that's kind of what our group is trying to do, this task force. Skip that for now. So what does this project do? What are our goals? What are the activities that this group works on? Well, the first objective is to reduce access to prescription opioids. And we do it a number of different ways. We are actively giving out drug destruction pouches in our communities of Ansonia, Derby, and Shelton. So if you work for an organization or you represent an organization in those 3 towns, we actually give out baskets of what are called drug destruction pouches. So we encourage people at home to go through their medication cabinets. And we often tell people the worst place to keep prescription medication is in your medicine cabinet. So if you yourself take any kind of prescription, and right now, any prescription medication does have value on the street, not just narcotics, stimulant medication, ADHD medication, all has value as a recreational type drug. Remove it from your medicine cabinet and put it in a place where just you have access to. If you want to lock it up in your bedroom, you can. You don't necessarily have to lock it, but don't keep it in a common area where all people have access to. There was a recent stat that said 80% of people who come to visit your home, whether it's people who are coming to do work in your home or family, visitors, friends, guests, 80% are going to look through your medicine cabinet, just to look. And if you have a prescription medication, we are not in the habit of counting our pills or our medication. Would we know if something, one pill of Concerta or Adderall had been taken out of a particular bottle and just pocketed in somebody walk? That's how simple it starts. It starts in our own homes. So remove that medication, put it in a safe place where you have access to it, so that it's just not open for everybody to come in and take or give it to them on hands. And our second objective is to reduce the percentage of youth who view misuse as low risk. So one of the other things that we are responsible for as an organization is that we have been providing a student survey for the past 20 years in all 5 Valley communities. And the number of young people who perceive that taking a pill that doesn't belong to them is low risk. We want to change that perception. So we had our student survey this year, this past winter, which was really just kind of after two years of COVID. And I have some results I'm going to share with you as well. But we really wanted to change the perception that young people should be taking or sharing their friend's medication because they didn't think it was a big deal. So we're going to kind of look and see where it is now. And we do a lot of education with young people in our high schools and our middle schools about what addiction is, what it looks like, and where it can start. And it can start by taking something that is not prescribed to you. So we really have upped our education efforts in Ansonia, Derby, and Shelton with middle and high school students. We also collaborate because it's a community issue. So our stakeholders include our municipalities, our youth service bureaus, and also our school districts, who are all part of our task force. We want to increase our collaboration with the faith sector. So we do have a link to Valley Parish Nurse Program out of Griffin Hospital, and we will be going in to try to get into some of the congregations to talk to our faith leaders about this issue as well, because they need to be a part of this conversation too, and educating their communities. And then engage youth in peer-to-peer education. So what that looks like is older students or high school students, when they have been educated about the misuse of prescription medication, how to talk to young people about the cycle of addiction, about what overdose is, youth are in a better position to educate younger students than adults are. And so we've gotten some really great small groups of high school students together that are juniors, seniors, provide them with some support and information, education, and then they are able to go in and talk to 6th, 7th, and 8th grade students. There is more of a trust factor there when it comes to peers and adults, and we've had a couple of different groups, one in Shelton, one in Ansonia, very successful in having our young people kind of be the voice of, this is what it's like in high school, this is what you're going to encounter, and you know, here's how you can say no. Or here's how you can ask for help if you need it. So the substances that we actually ask about on our student survey, we call them the core measures. We ask about alcohol use, marijuana use, tobacco use, nicotine in the form of vaping, because actually cigarette use is so low we don't even ask about it anymore. But the vaping of nicotine and THC is really an issue at all of our high schools. Not just our high schools, we have kids in middle school who are getting caught with devices in school. So it's become a real problem, and a lot of our high schools are struggling with, what do we do? Do we have consequences, or do we support with some help and education? So it's kind of working together and coming together to decide what's the best course for students who are bringing this stuff into the school, using it during the school day. We've had instances where kids have gotten sick during the school day, transported to the ED, not because of nicotine, but because of high potency THC and the severe mental health effects that often come with that. So our measures are 30-day use. So we track, we ask, have you used any of those substances in the last 30 days, which would be recent use. We ask about their perception of harm of a particular substance. We also ask about if your parent knew that you were using any one of those substances, would they be upset about that? So we track perception of parental disapproval and then their peers. If your friends knew that you were vaping, if your friends knew that you had had alcohol to drink, would they be upset with you? So perception of disapproval is really important because it's about messaging. And right now, the perception of harm, if you were to guess, the perception of harm of recreational marijuana among our youth would be what? Low. It's very low, extremely low. Yeah. So here's our recent use rates among our 7th, 9th, and 11th graders. Now, those are the groups of students that we have been tracking or that we provide the survey to for the last 20 years. Why it was decided it would be 7th, 9th, and 11th, I don't know, but we kind of stuck with that. So our recent rates for, as you can see, for cigarettes is 1%. It's not even kind of worth addressing or talking about. But nicotine use is 9%. That jumped from at least 10 years ago. So nicotine use is because it's being used in a vape device. So recent nicotine use in 2019, which was during COVID, was actually just before schools shut down in 2019, we did the survey. So it was at a rate of 9%, but 2022, this past winter, when we did the survey, it went down to 4%. Our marijuana recent use rates were at 7%, it's now down to 3%. The use of alcohol in 2019, 10% of all of our students had engaged in alcohol use 30 days prior to the survey. We're now down to 3%. So what's nice about this is that we think during COVID, there was restricted access to substances because kids were remote learning. They were home with their parents or they were home unsupervised, but they were not connected to school. They were not connected to peers socially. So we're happy that these rates went down, but it also happened during that 2-year span of COVID.
It's all self-reported, so.
It is self-reported and it's anonymous.
Yeah.
So students have not, or they're never identified, and they know this. And these last, the 2019 and 2022 survey are taken on a laptop. And what we know from research from all across the US is that students who participate in anonymous surveys tend to be overall truthful about their use. Some additional substances that we do track, inhalant use, which tends to be something that maybe 7th graders begin experimenting with as a young middle school student. Inhalant use in 2019 was 0.4. It went up a little bit to 0.9, but again, inhalants are products that are accessible at home. So sniffing, inhaling, it could be air freshener, it could be keyboard cleaner, those kinds of things. You have access to those products at home. It's not necessarily in your school environment. Over-the-counter medication, it was 1.7% in 2019, went down to 1.3 in 2022. Steroid use, it was 0 in 2019, but 0.5%, again, very small in 2022. The term uppers, which is described in the survey question to the students, if they know what kind of substance that refers to, is 0.4%. Tranquilizers was 0 and then 0.4% for 2022. Downers, 1.4% and had increased from the last survey period. And then pain medication. So the use of pain medication, now 1.3% is relatively small for 2019, but that's 70, 80, 90 students out of the 3 towns who were accessing pain medication. It went down to 1%. So these are additional medications or drugs that we do ask about because the funding that we receive wants us to ask about and track methamphetamine use. And the reason why methamphetamine use is important to now kind of focus on is because after every opioid epidemic follows a stimulant epidemic. Mm-hmm. And methamphetamine is already making its way back into Connecticut. Not necessarily in our valley communities, although there have been some combinations of drugs that have been picked up where meth has been mixed in with cocaine or meth is mixed into pressed pills. And New London, New Haven, Waterbury have seen methamphetamine make its way back into those communities. So it is something to look out for. Perceived risk of harm of substance use. So this is the student themselves thinking about how harmful these substances are to me if I choose to use them. So marijuana, perceived risk of harm was 49% in 2019, and it did go up to 54%, which is it was surprising to me. And the question is, if you are using every single day, what is your perception of risk of harm? Is it harmful to you? Alcohol, if you use alcohol every day on a daily basis, it was 76% in 2019, went down a little bit to 74%. Using an e-cigarette Now, back in 2019, the perception of harm among most students is that 66% thought, yeah, it's pretty dangerous to be able to use this every single day. It actually jumped by 10%, which was good. So 75% of students in those grades think that using an e-device every day is harmful. Misuse of prescription drugs. It was pretty high in 2019, 2022, dropped a little bit. We want to see that perception even higher. We want more students to think that taking a medication not prescribed to you is really dangerous, especially when it comes to buying stuff on the street, pressed pills. Cigarette use. Out of all the substances, young people still think that cigarettes are the worst thing that you could do. Smoking every day, 80% thought it was harmful, up to 81% in 2022. So they know the dangers of smoking, tobacco, cigarettes, but we have to get that misuse of prescription drugs to be just as high or even higher. So parents. So students are asked, if your parents knew that you were using these substances, would your parents think that it was wrong for you to do? So when it comes to misuse of prescription drugs, students say that 96% in 2019 and 97% in 2022. All of these numbers for all of these substances are really high. They knew that if their parents found out that they had experimented with, tried any of these substances, they would be very upset with them. That's a good message. That's really good. So parents are supporting our message that this stuff is really, it's not good for you to be experimenting with, trying, taking from a friend. So parents are doing a good job. So friends. Now, interestingly, when it comes to prescription drug use, their peer disapproval, if their friend thought that they had been using a prescription drug, 83% thought it was harmful in 2019. It did go up to 87% in 2022. For all the other substances, it is much lower. Smoking tobacco, yes, peers would disapprove of that. It actually jumped in 2022 up to 83%. The use of e-cigarettes in 2019 was much lower than it is now. I think that with the education that's happened, maybe in the last year or so, and some of the media reports of the kinds of issues that e-cigarette use can cause, you're more at risk for COVID. Students were hearing that message. You're more at risk for upper respiratory issues, spreading of other kinds of germs. And we have also talked a lot about, there was a young man, high school man in Colorado who needed a double lung transplant. Had been vaping progressively for about a year and a half using a Juul device and ended up destroying his lungs to the point where he couldn't breathe anymore. It was the first case of an adolescent who needed to have a double lung transplant directly correlated to e-cigarette use. The smoking of marijuana, surprisingly, that also increased. So if my friends thought that I was using marijuana on a daily basis, 75% of them probably would disapprove of me using it as a student. Drinking alcohol, it was 69% in 2019, but if my friends thought I was drinking alcohol every single day, 78% disapproval rate. So that's good too. And I'm going to stop here just to see if you have any questions about any of the data I presented, or any of the activities that we are involved in. We're looking to engage more people to be more aware and become educated about our group. We meet monthly at the EcoHost Training Center.